Good afternoon.
Hello.
I'm Dr. Josh.
I'm Dr. Kristina.
And welcome to our Facebook Live video for Crossroads Chiropractic.
For Wednesday.
And for Wednesday. And we're so excited that you guys are watching. And like our nice background, we just changed our background. I'm like, man, that's boring. Maybe it's a good thing. I don't know.
It's calming.
It's calming.
It's okay.
It's a calming color.
The lighting's better on this side.
That's right. So today we are talking about some patients of ours have this long lost relative who comes and visits all the time, and his name is Arthur-Itis. I got Arthritis is coming to visit me. And Arthritis usually shows up after a long day at work or when it's raining like it is today. Right?
Yeah, actually.
When the pressure changes, apparently Arthritis shows up. So,
yeah, it does.
If you don't know what we're talking about, we're talking
not
about...
a friendly visitor.
Not a friendly visitor. If you don't know what we're talking about arthritis, right?
Yes.
I know we're kind of joke about it, but it is something that's very, very significant and affects a lot of people. So today we thought we would talk about it.
Yeah.
And share with things that we can do to help, which is fantastic. Awesome. So what's arthritis?
Arthritis. It's inflammation, basically, in the joints. And it can be caused by, usually if you've had a trauma to a joint, so like a physical injury, like to your shoulder or to your wrist or your hand, you can get problems in that joint. You get more inflammation, more swelling, and the bone starts to change, and the surfaces of the joint will start to change and roughen, and then you'll have pain and things in those areas.
Yeah, absolutely. So it's very, very common post-injury, and if you've ever sprained an ankle or broken a bone or all that stuff, it makes you prone for it.
Yeah.
Now, we see it a lot in our office because if you don't have proper spinal function and proper spinal structure, the engineering of your spine changes, and that promotes arthritis. So research has shown that any shifting away from normal in your spine will break down 300 times faster. And that's what arthritis results in, right?
Yeah.
So it's basically early degeneration. Our bodies are not designed to degenerate that way, right?
No.
So it's always because of something has happened, right?
Yeah, exactly.
So obviously there's different types of arthritis too as well, which we need to touch on as well. So there's the classic, which we're talking about primarily, which is called osteoarthritis, right? So osteo means joint or bone, and that can include, when it hits the spine, you have osteoarthritis, but you can also have degenerative disc disease, so DDD. So it's the same thing. It's osteoarthritis of the
degenerative
disc.
disc disease and degenerative joint
disease. Yeah, exactly.
That's
So those are all talking about the same thing, and that's that improper wear and tear, the spine's not moving or the joint's not moving properly. Right?
Exactly, that's it.
The other ones that we do see often are probably more the inflammatory style, yeah. And so those would be like
rheumatoid arthritis,
psoriatic arthritis, ankylosing spondylitis. Those are the three main ones, right? Really, for the most part. There's actually textbooks on significant numbers of different. So rheumatologists, they spend a lot of time distinguishing which type that you have. So honestly, we're less concerned about that. We're more concerned about how you're doing, really, for the most part, and if we can help. So
exactly.
So for osteoarthritis, what do you need to do?
Get adjusted first of all.
You need to get adjusted. You need to start moving.
You need to start moving. Yeah.
Basically, what happens is if a joint is stuck and it's not moving, that's what actually causes those joints to break down.
Yep.
So you sprain your ankle, you sprain your knee, you have that injury, you have that misalignment, and then over time, if it's stuck, the joint gets stiffer, and then that's what leads to the arthritis. So that's why a lot of our seniors have arthritis in the knees, arthritis in the hips,
arthritis in the ankles.
And arthritis in the ankles. It's because of an old injury and a long-term improper stress over years and decades until they get so broken and they have to be replaced.
Exactly.
And same thing with your spine.
Yeah.
So yes, the best thing you can do really is get adjusted.
Yeah. Absolutely. And keep moving, because motion is lotion
Yeah.
for your joints. So keep walking as best you can, keep doing things every day that you can get your body moving, because it's going to really benefit you over time.
Absolutely.
And create more longevity for your joints.
Absolutely. So getting adjusted is probably the primary thing, but things that you can do at home: keep moving, keep active, right? You want to exercise, you want to be active, you want to do stuff. You want to limit the amount of time that you're sedentary, sitting on the couch, watching TV, those type of things. And a lot of people, they're stuck doing it. Like, you're stuck at the office sitting for a long period of time. It's hard to get away from it. So you need to, one recommendation I do is for patients who do have significant arthritis, hips, knees, ankles, spine, is when they sit for a desk for a long period of time, is to set a timer for every 20 minutes to get up and move around, or things like that.
And while you're sitting, just move your position as much as you can too. Usually every 10-15 minutes, just move.
Like you're on a boat.
So you're not exactly. So you're not always sitting in one static position.
Yeah.
Right.
Which is a great idea. So it's something that really is very proactive, because the cartilage in your joints actually feeds by pressure gradient. So as you move, you're actually squishing out the bad stuff and moving in the good stuff,
moving
right?
all
So
the liquids around that you need.
Which is fantastic.
Yeah, exactly. Just one last one actually that I thought of just right now is taking a warm bath with Epsom salts. Because that really helps with muscle soreness and joint soreness. But you don't want the water too hot, and you don't want too much of the Epsom salts. But but two tablespoons, I think, in a tub that's warm is perfect.
Fantastic.
Yeah, that's a great one.
And it's really good for detoxing too, as well.
Yeah, that's
which
true.
is great. Yeah. And obviously, there's lots of things you can do nutritionally, which we're not going to even touch on today, because there's just so much to talk about.
There's really a lot to.
There's really a lot, because you basically want to lean towards more an anti-inflammatory diet versus an inflammatory diet, right?
Exactly. So, yeah.
But if you do have osteoarthritis or any type of arthritis, we get great results obviously with osteoarthritis because it's proper movement, but even things that are autoimmune like the rheumatoid and the psoriatic and all that, we've seen pretty significant improvement in patients when their spine's working properly and when their nervous system's working, because your nervous system and your immune system are the same thing, right?
Together.
So chiropractic plays a huge role in patients who are suffering, depending on even the level of severity of your arthritic condition that you have.
Yes, absolutely.
Which is awesome.
So if you want to learn more, or if you want us to continue talking about ways to deal with arthritis and osteoarthritis, rheumatoid arthritis, or anything really, just leave us a comment, and we'll continue the series if this is something you guys want to learn more about.
Absolutely. Or if you have any other questions of different stuff that you may be dealing with, or a friend may be dealing with, let us know. Leave a comment and leave a question in the comments. Give us a ring, give us a shout, email us, text us, whatever it takes, right? Because we want to make sure we're providing the best information for you that you find helpful.
Exactly.
Which is awesome.
Excellent.
So
awesome.
I think that's pretty much all we have to say.
Yeah,
these have been longer and longer, and we're laughing less. This is very boring.
Oh, no, it's not boring. It's informative.
It's very informative. Awesome. So
great.
Thanks for watching. If you like us, follow us on Facebook, on Yellow Pages, on YouTube, Instagram. Check out our website,
crosschiro.ca.
Awesome. And give us a shout. Call us 905-830-1146. And like I always say, if you're seeing a chiropractor, awesome. Get to your chiropractor. Tell them if you're, you got arthritis, let them know the things that they have so that you can keep you moving. Absolutely. If you're not seeing a chiropractor, you got to check one out. If you're in the area, give us a shout. Yeah, we'd love to take care of you.
Okay.
Perfect.
Have a great afternoon, everyone.
Have a great evening. See you later.
Bye.
Bye.